Thank you, Dr. Dart. And I want to start by reiterating what Dr. Dart just had to say, that we are in the critical moment, as all of our modeling shows us this week. Everything that we've done as a community for the last month to prepare and to minimize the opportunity for an overloading of our healthcare system, it all comes into play this week when we expect the daily contagion rate to hit its peak in Tulsa County. That's very important when you think about the overall lifespan of this virus within an individual, because that leads us to the other peak, which we would expect in early May based on the Tulsa Health Department's modeling, which would be the daily hospitalization rate. And so what we do this week, more than any other time, will have an impact on the peak rate that our hospitals receive from daily hospitalizations coming in. So I would ask everyone, I know that we've been enduring this and sacrificing through this for a month now, but this is the critical time. And so please remain patient, remain vigilant, continue to practice social distancing. And if we do that, then we, all of us as a community, will give our healthcare system the bandwidth it needs to process those who need the most urgent medical care. And each of us will play a part in saving the lives of thousands of our neighbors. So I would ask everyone to continue to practice those social distancing practices that we've put in place and that we've all been trying to follow for the last month. What we see in the data so far that's out there around mobility is that it's working. What we're doing as a community is working, but we cannot let up now. We have to continue what we've been doing. And so long as we do that, we should feel a lot better about the odds of our hospital system being able to handle that peak that we expect in early May. I also want to make sure that all the veterans in our community know that if you would like to get drive-through testing, the Eastern Oklahoma Veterans Clinic is providing that here in Tulsa tomorrow. And you can call to schedule an appointment to do that testing at 1-888-397-8387. Again, that's 1-888-397-8387 for Tulsa area veterans if you want to participate in that drive-through testing that's available for you. A little bit of an update on our team at the City of Tulsa. You know, the most important thing that we do at the City of Tulsa is serve our citizens, and that requires an outward-facing organization. So we have hundreds of city employees who are out in the field every day assisting Tulsans, and with that comes exposure to a lot of potential opportunities to contract this virus. So far, we're fortunate in that we've only had one city employee who has tested positive, and that employee is recovering well. I'm very grateful for that. But as of today, we have 45 different City of Tulsa employees who are quarantined and under observation by our city medical staff to make sure that they're safe and healthy and can get back to work in a safe period of time. Also at the City of Tulsa, we are not immune to the economic impacts of this virus. And we are projecting as of today to end the year about $2.7 million behind where we were budgeting for. It would be a lot worse if we hadn't had a very strong first 3 quarters of the year. But everything that we see from an employment standpoint, from a crude oil standpoint, and so many other indicators that we utilize to determine what our sales tax revenue is going to look like, shows that it's going to be a very difficult final quarter from a revenue standpoint for the city. And that's what funds our police officers, our firefighters, our crews that go out to work on our streets. It's important for the citizens of Tulsa to know, though, that the city council and I have been very diligent over the last several years in building up our rainy day fund. And if ever there was a rainy day, this is it. And so we will be utilizing that over the balance of the year, we would expect, so that you won't see a reduction in law enforcement personnel out there or fire personnel. We will continue to make this a safe place for you to live and do business. But I will present the upcoming year. At the City of Tulsa, our fiscal year ends June 30th. Our new one starts July 1. I'll present next year's proposed budget to the City Council next Wednesday evening at 5 p.m. And that will continue what we would expect to see right now with a very difficult financial picture. One that those of us who were around for the Great Recession haven't seen anything really since that time. And it will require sacrifice from us at the City of Tulsa, but we will continue to provide the most critical services for Tulsans so that you, again, can have a safe place to live and recover as we get out of this pandemic event. The last thing I would like to remind everyone about, we're in a critical week as it relates to COVID-19, but we're also getting into tornado season. We're just shy of a month from, just about almost a year away from the flooding that we had in May of 2019. And I would ask everyone to please be weather aware. I can't remember the last time it was this cold in the springtime in Tulsa, and yet that's what we should expect from a weather standpoint here in Oklahoma. And so while we're all focused on avoiding contact with others and practicing social distancing so that we can get through this peak contagion rate of the virus, we also need to be mindful of those natural disasters that we're more accustomed to dealing with. And so I'd ask everyone, I think most of us probably know this already from experience, but if you don't have a place in your home that you've identified as a safe place to go in the event of a tornado, please go ahead and use this time to find that location and keep your eye on local weather reports and be prepared as we move into tornado season here in Tulsa.